right, we're all ready.
Hi, everybody, and welcome to Dry Eye Happy Hour. I'm Rebecca at the Dry Eye Foundation in Poulsbo, Washington, where we are having a glorious sunny day. Aiden is on the other side of my wall, and thanks for joining us. I'm ready to get started today. Very excited to be talking about corneal exposure. This is just an issue that doesn't get anywhere near enough attention. It just flies under the radar a lot. So we're going to be talking today about what these exposure issues mean, what they're like, things that cause them, and how this makes things different when that's the primary reason for someone's dry eye issues, or as we prefer to call it here, ocular surface pain and ocular surface disease. So for those of you that are new to us, we're going to have a panel discussion for about an hour today on exposure related dry eye. And then as we're wrapping up the discussion, we'll open things up. Anybody who wants to join in, have your video and audio turned on, can raise your hand and can take care of that. And we can just carry on the discussion from there. So today we have Rachel, Phyllis, Alyssa, and Brittany with us. And just a huge thanks to the four of you for being part of this, and to Cindy, as always, for all the work she puts into finding really great people to be part of the conversations. So we're just going to go around and do our usual intros. I'll post the questions in the chat thing here. I know I can never remember them all. So I'll put it in there we go. So gonna start with the two of you that are newest to us here. So let's see, Alyssa, why don't you go ahead? Just
Sure.
introduce yourself with our.
Will do. Hi, everyone. I'm Alyssa. I currently live in New Jersey. The beverage that I'm drinking is water because I just finished my workday here, so I haven't gotten started on happy hour yet. How long have I had dry eye? So I have had dry eye for almost 12 years to the day. I had a brainstem cavernoma removed when I was 18, just 3 days after my high school graduation. And following that, I had damage to my sixth and seventh nerve. So my eye and my smile were affected on the right side. And because of that, I can't fully close my eye. So I'll get into some of that as we talk through tonight. And then the eye drops that I use, I currently use sodium chloride, which is a prescription, and I use the PROS device, so that helps to protect my cornea. And then I'll fill the PROS device because it is like a large lens, and I'll fill it with the sodium chloride and then pop that into my eye. So happy to discuss more of that after we get through our introductions.
Super, thanks, Alyssa. Brittany?
Hey guys, my name is Brittany. I live in Kentucky, specifically right on the border with West Virginia. Always drinking water. That's my beverage of choice, stay hydrated. I'm sure all of you know that's very important for us. See, I've actually had, back then I thought it was just dry. Back in 2007, I was in high school. I was wearing contacts. And I started not to be able to wear the contacts as long. I got to where I couldn't wear them for more than like an hour. And then I noticed I started waking up in the mornings with really dry eye. I had no idea what was going on. It was just, and it didn't really affect my life at that point very much. And I knew since I was born that I had slit my eyes open. I just never really realized it would cause an issue. I had laser eye surgery, PRK, in 2016, and that's whenever really everything just went downhill. And but at this point now, it's been 5 years. I'm maintaining. I had a surgery a year ago to have the gold weights into my eyelids. The surgery itself went awful. We'll talk more about that later. But today actually makes 1 year. 1 year exactly that I had my gold weight surgery. So kind of a big day for me. Been thinking a lot, but I have had some improvements. Let's see, eye drops that I use, Sustain, preservative free, of course. That's just like the moisturizing drop. I use Fresh Coat, to kind of suck moisture out from the epithelial layer, and then I use Lotamax steroid drop as needed whenever I have flare-ups. So, but I look forward to talking to you guys and answering more questions.
Awesome. It sounds like you both just have fascinating histories. We're going to have so much to talk about. It's really great. All right, Phyllis.
Hi, I'm Phyllis, and I live in San Diego. Water's my usual beverage of choice. Been working on staying hydrated for many, many decades of my life. I drink a little coffee in the morning, even though I know that tends to draw moisture out of the body, but that's how it goes. And I have an occasional glass of wine before dinner. I have had significant dry eye since June of 2014 as a result of a right side facial nerve damage from my second acoustic neuroma surgery. I'll talk more about that later. This is a lifetime journey. I'm 70 years young. I've been on the acoustic neuroma path for 22 years now. Management and maintaining routine help lessen the impact. And not having not only ocular surface disease, but a whole cascade from the facial nerve damage. Pretty big impact on my life. And eye drops, Refresh preservative free Celluvisc gel drops are my all day, every day go-to.
Awesome. Thanks, Phyllis.
Sure.
Rachel.
Hi, I'm Rachel. I am from Southern California. I currently reside in North Hollywood. I was born in Anaheim, so I've been in Southern California my whole life, and the Santa Ana winds are just the bane of my existence. But it's all started when I was diagnosed with a brain tumor and anaplastic astrocytoma of the brainstem when I was in kindergarten. And that is when I started having nerve issues. My mom actually initially took me to the doctors that got me diagnosed over my smile being crooked and not correct. And based on the surgery and everything, it was like 95% removed, but there was still a little bit in there, leaving some nerve damage to the like 7th cranial nerve or something like that. And so my left eye doesn't close properly at all. I've had, over the course of my life, they've tried everything. It seems like I saw every dry eye specialist through Kaiser in Southern California, and I had various procedures. They put in a tear duct at one point. They did the gold weight thing to make my eyelid close more properly, but I don't think that actually worked. We probably did the surgery twice, and I had done it with the original person's protege. So it was actually like her first surgery, and I don't know if she really knew what she was doing. But yeah, I'm not sure the gold weight ever really did much for me, but it's still there. And so I'm at the point where I finally got to see a long-term survivor specialist at USC, and they referred me to the person who gave me the scleral lens, and that's been for the past year or so almost. I've had the scleral lens, and it helps in some ways, kind of a hindrance in others, but I haven't had any chance to follow up because of healthcare insurance stuff. Hopefully that'll happen soon. And I'm drinking lots of water because it is super hot right now.
That's right. You guys are baking down there very much. All right. Thanks, Rachel. Gosh. Okay, so you have all mentioned a certain amount about how this started, and now we're just going to start digging deeper in. I'd love to just kind of unpack how this started a bit more, particularly kind of how and when you found out that exposure specifically was a problem, or the extent to which it was a problem, where you really started understanding what was going on. I mean, there are some situations where you know immediately and you're told everything immediately, but I think in exposure situations, as well as other kinds of dry eye, that's a more gradual process. Maybe you don't know until after something else happens that this exposure thing was putting you at higher risk, or just a lot of different types of situations. Who would like to jump into that first? I'm kind of tempted to pick on you, Brittany, because you come from a laser surgery background like me, and I get those places.
Okay, yeah. So as I mentioned, I was born with which I've heard the doctor say it two different ways. I say it lagophthalmos. I've heard different ways from different doctors. But I just never thought that it would be an issue. I didn't understand it. And then when I had the laser eye surgery, and he told me I was going to have LASIK, but then he done some tests on me, and he told me my cornea was too thin to do LASIK, but he said that PRK was safer anyways, that it just took a little longer to heal. So I was like, yeah, let's go with that. Turns out, he didn't test for like lid closure. If that would, I feel like that should have been part of the consultation. It's very easy to test for. Now I know this. Not only do I have nocturnal, my blinks don't even close all the way. So I went in for PRK, and about a week later, I woke up. My face was just covered in tears, and it felt like somebody was stabbing me in my eyes. Had no idea what was happening to me. Eventually got into the doctor and told me my corneas look great. And I'm like, there's no way. I eventually started doing my own research about a month. So this was 2016, June. So about a month later in July, I found this group. I found the Dry Eye Foundation and the Dry Eye Talk. And I started looking up symptoms. And, I discovered myself that I had recurrent corneal erosion that was caused by the laser eye surgery. And, I told the doctor on my next visit, and he's like, well, yeah, that might sound right. I think you might have recurrent corneal erosion. So we started doing different treatments. Of course, the first suggestion is more eye drops, warm compresses. Then the next biggest step, which took me about 6 months to get to this point. And this was 6 months of non-functioning. I couldn't hold my eyes open for more than 2 hours at a time, really. I couldn't stare at screens, couldn't work. The amniotic membrane, but even before the membrane, I had the plugs. They didn't do much help. I tried every drop. And then the amniotic membrane, because I was having erosions almost every day. So for 6 months, I was having them almost every day. He heard of a thing called Procara, which is the amniotic membrane. We did that. He actually got them for free for me because he had never used them before. So I was like his guinea pig. I was the patient he practiced on, and actually didn't have erosions for about 6 months. But when I got back to wintertime is when they began again. But that was really like the biggest thing that took me from a non-functioning human to kind of being able to open my eyes for more than a few hours at a time. But as far as really understanding, I mean, it's been 5 years. I'm still learning things. There's always still something to learn. There's new information that comes out. And at this point, I'm maintaining. And as far as the gold weight surgery last year, the surgery itself went really bad. The surgeon actually put a big gash across my eye. So I woke up that evening like, and I'll show you some pictures, you know, here in a little bit of the stitching on my eyelids. But now at this point, so 1 year post-surgery, today makes 1 year, I do think, you know, the gold weights are helping me personally, you know, getting my eyes to close. You know, my eyes aren't exposed every night. And I think that was what was really important, was they were throwing all these treatments at me, but the root cause was the fact that my eyes weren't closing all the way. So my eyes could never heal. So.
Wow. To what extent was that fact recognized? I mean, you've seen multiple doctors, I'm sure, but
Yeah.
and you had things going on. I mean, that gets complicated. Then it's, you know.
Mm-hmm. Yeah. So they, like I said, you know, I went through all these treatments, you know, plugs, every drop that you can possibly think of. Mira 128 ointment has been the best for recurrent corneal erosion for me. You know, goggles, blood serum drops, different types of medicines, doxycycline, antibiotics, steroid drops. And, you know, I've seen 11 eye doctors. So I'm like on my 11th, and hopefully, you know, hopefully my last. But there was really just about 2 or 3 of them who kind of really knew what they were talking about. And the others really just said, hey, your corneas look good. We don't know what to tell you. Just, you know, keep using eye drops. That was, you know, the extent of it. Go ahead.
Yeah. Of those 11, the one or the 2 or 3 that got it, who, I don't mean names, but who were they in the sense of these optometrists, ophthalmologists, cornea specialist ophthalmologists? Who were the ones that were there for you for this?
So it's actually, and living in Eastern Kentucky, I am very limited on resources. Eastern Kentucky is actually kind of like its own little bubble. We're known for being a very poor area here in Appalachia. So I've really had to travel a lot. But actually one of the ones that helped me a lot and was very understanding was local to me. And I don't know if you mind if I use names. It's because it's positive. His name was Dr. Norden. You know, he was an optometrist. He didn't quite understand, but he really could see that I was in pain. And I mean, he made so many calls. He actually, when I had my surgery last year, I was in the emergency room all night. And next morning I saw an ophthalmologist, and I was like, hey, can we get an amniotic membrane in? Like, if there's a gash across my eye, I said, I've had it before, I know it works. She actually refused to put it in. She told me she would only put a bandage contact lens in. And I told her that doesn't work for me. They stick to my eye. And instead of trusting me, you know, she was kind of being stubborn and she refused. But I called Dr. Norden and had to end up driving over 2 hours back after being in like excruciating pain for 24 hours. And he put the membrane in, and it was like, you know, immediate relief. But like, he trusted my opinion. So he's been very understanding. And another very important doctor, Dr. Paul Karpeki. He actually, I think he does a lot of conferences across the United States. He has what I have. He has lagophthalmos. You know, I think his left eye doesn't close all the way. He has recurrent corneal erosion. So he has been just really a godsend for me.
That's great. Talking of Dr. Nord, and just kind of for everyone's reference, let's going forward, let's not do more names, but
Okay.
you mentioned the optometrist. It's just more kind of a group policy thing, but it's, especially when you're in a remote area or anything like that, it's so hard to find the right resources. So I totally appreciate the need to share. And I mean, our groups are just like the Facebook groups and things are a great place to do that. But what struck me when you were describing your optometrist was, you said he could see that I was in pain.
Mm-hmm.
And we don't all get, even out of 11, sometimes we may not get a doctor who does that. So it's profound. And I love that you kept going and that you held out until you had somebody who got the real point and would go to bat for you. And as you said, trust you, because by the time you had a lot of knowledge and experience, and we all do, we are all the experts in our experience, right? We deserve to be trusted on these. Wow. Okay. So we'll circle back to some more of this. Alyssa, how about you jump in there? Oh, can you unmute yourself?
Sorry about that. Okay, I have a puppy here, so I put myself on mute so that I could listen in. So my journey started, as I mentioned, I was 18 when I had to undergo brainstem surgery, and as a result of the surgery, the bleeding from the cavernoma prior to the surgery left me with a 6th and 7th nerve palsy. So it definitely affected my eye closure. I can't close my eyes, similar to you, Brittany. I also have a gold weight, which they put in. And Rachel, you were saying that your gold weight hasn't helped you. And I actually found in talking to a few different plastic surgeons, they were saying that they're starting to see that gold weights are sometimes ineffective for people with severe facial paralysis. So that could be why you and I just don't have the same positive experience as Brittany had with the gold weight. But after my brain surgery, I had a very long recovery. And then fortunately, in seeing all different doctors, I was then led to Weill Cornell Hospital, which told me about the PROS lens, but it took probably 2 years to find them. My parents and I were going to all different eye doctors, and we knew that my eye was dry, and I was using the Sustain eye drops like all day, every day. And I was using a night serum, and I just wasn't getting the relief. And when we would go to these different eye doctors, and some of them were ocular specialists, some were cornea specialists, they were just like, okay, we'll try Botox in my eye to get the eyelid to close a little bit. So we did that. That was an awful experience. I mean, I was 19 years old and my eye was like half shut. And then another doctor suggested, okay, you have the gold weight. How about we put tape on your eye and you could tape your eye shut, which if you have a gold weight, you could feel that's so uncomfortable to then have your eye taped shut. And other doctors just passed this around. And fortunately, when we got to Weill Cornell, my parents would always ask these eye doctors. My parents don't have a medical background, and they would always ask, like, but why can't you just wear a contact with no prescription? Won't that help to cover the cornea? And when we got to Weill Cornell, they said that, and the doctor was like, yeah, absolutely, we're going to get there. And then thankfully I was fitted for the PROS lens, and it's helped me so much. I take it in and out to go to sleep, and when I wake up, I put it back in. And it allows me to live my life. I have to use eye drops still during the day, especially on the computer all day long. It does dry out your eyes, but I've had close to 12 different facial reanimation surgeries, and I'm actually going back for another where they're going to take a piece of like a ligament from my ear, and they'll put it right under here. So that'll help to pull this up a little bit. So I maybe won't have as much of a dry eye, but I always say at least we're living through this right now versus 20 or 30 years ago when none of these awesome techniques and materials existed. So while at times it's very difficult, we have to look at it as we're fortunate.
That's so awesome. Just kind of absorbing kind of the echoed stories of numbers of doctors and how long it takes to get to there where you've got what you need to move on. And also the difficulty finding people with experience, understanding the practicalities of, they give a recommendation. So medical treatments are one thing, but the practical stuff, the taping an eye down that's got a gold weight in it, the practicality of it, what does that play out as? It's an easy recommendation to make, but in real life, is it doable? There's just so many of the practical day-to-day strategies that the nuances of it we struggle with. Wow. Rachel, gonna jump over to you. Is there more you'd like to share about this? Kind of when you knew what the problem was, really. I mean, just had some clarity on that and moving forward.
I was so young when I had my surgery. I honestly can't remember. It's just like my entire life, my eyes have been so dry. And I think as a kid, my parents were told, like, make sure she puts her eye drops in a certain number of times per day, and that never really happened. And then as I was like a teenager and young adult and everything, I just started looking on the drugstore shelves, trying to see what was the most effective eye drop that was the cheapest, I guess, but they're never cheap if they're actually effective. And yeah, I actually forgot to mention the one that I'm using. That's the one I always forget is which eye drop. And I guess I have Sustain Complete is what the last eye drop that I put in, and I'm using Refresh PM at night. But Sustain is usually a pretty good brand for me. So yeah, it's just something that I've dealt with my entire life. I actually I've been blogging at the Children Cancer Cause blog about like my issues as both a long-term cancer survivor and like the day-to-day things that I deal with, like dry eye and hearing loss. And so that's it gets complicated when you have to deal with everything. But yeah, that's one of the things that a lot of people don't talk about. When they're talking about kids who have cancer, it's mostly just like, well, let's make sure these babies don't die, and then it's not like a quality of life thing that you have these issues like hearing loss and dry eye and whatever else, partial facial paralysis and things like that. So that's one of the things I've been working on advocating about.
Mm-hmm. I know you have a lot you could say about this, Phyllis, that just, yeah, that aftermath that isn't,
Yeah.
Why don't you go ahead?
Okay, thank you. Yeah, as a result of the right side facial nerve damage from the acoustic neuroma surgery in June of 2014, and that was my second acoustic neuroma surgery. And the first one went great, and the second one, I had lots of fallout. Um, as a result, my right upper eyelid does not close fully, nor does it open fully. My right lower eyelid sags. I have zero tear production in my right eye. I also lost my hearing on the right side. Um, I have no automatic eye blink of my right eye. And the vision in my right eye is always blurry because of all the products that I use. But I have trained my brain to compensate. I still drive very competently. There are a lot of things I don't do anymore um, because I have very little actual depth perception anymore. And I am very grateful that my left eye is fully functional. I have excellent vision. I had cataract surgery in 2006 with implanted multifocal lens, and I have very, very, very minimal dry eye symptoms on the left side. Um, when did I realize there was a problem? Wow. Um, Immediately after the acoustic neuroma surgery in early June, I was still in the hospital. Eye problems on the right side were very obvious. I had an immediate surgery. I had 3 procedures. They implanted a gold eyelid weight in the upper eyelid to help with closure. They did a tuck up pull up, I forget the technical term, of the lower lid for better closure. These two procedures were to help protect my cornea. Additionally, my right eyebrow was raised, and I kind of chalked that up to like trying to make me look a little more balanced. And while the eyelid weight implant helped closure, it also caused a huge cascade of problems. My entire right eye and upper eyelid were always inflamed. I couldn't open the upper eyelid fully because maybe it's kind of a crapshoot when they're choosing the weight of the eyelid implant. So mine turned out to be a little too heavy. Um, and my eyelid not opening fully always put pressure on the upper part of the cornea, which caused astigmatism, blurry vision, and a lot of discomfort. I began having some appointments with a neuro-ophthalmologist for evaluation. Several medications were prescribed for dry eye due to inflammation, initially Restasis, then later Xiidra. I didn't tolerate either of those medications. Burning, stinging, not something I needed to add to the mix. I also obtained no positive benefit. At this point, I was trying all the preservative-free drops and gels that I could access. My facial distortion wasn't improving. I consulted several surgeons about facial nerve reanimation, surgical options. The reanimation helped the lower portion of my face, but unfortunately not my eye area. Several years later, the universe sent me to an oculoplastic surgeon for evaluation. We decided to remove the gold eyelid weight implant, hoping for reduced inflammation without losing too much corneal coverage. Boy, is this a delicate dance. Closure versus non-closure. Um, I wound up with less inflammation after she took it out, less corneal coverage, unfortunately. We tried another approach, a dermal filler in the upper eyelid where the gold eyelid weight had been placed. Again, hoping for better closure. A little more weight, but not as much as the gold eyelid implant. Ouch. Immediate, enormous allergic reaction. Some of the worst pain I've had on this journey. So, dermal filler was dissolved and the negative reactions quickly resolved. Oh, more time passed. Oculoplastic surgeon recommended another lower lid tuck. That was very successful. Um, and this is like an ongoing thing because the damaged facial nerve does not trigger any eyelid muscles. So nothing works naturally. And now we're talking about implanting a platinum eyelid weight because platinum is considered less reactive than the 24 karat gold implant. Um, Also talking about another lower lid tuck. She also wants to redo the eyebrow lift. And at the same time, I might have another facial nerve reanimation or two procedure, hoping for less facial distortion and a more balanced facial appearance.
Wow. Okay. So we've
Sorry
covered.
that took so long.
No, you're good. We've covered a lot of ground in terms of medical treatments and things, and a lot of discussion about weights, which has been interesting to me, and gold, platinum, what the procedures are like, and yeah, Brittany, with you having that go so far south in terms of the process, but actually seeing benefits afterwards, and some of you seeing benefits, some of you not. I'm curious. Sheer curiosity, if any of you ever tried the little stick-on ones. Do you know what I'm talking about?
Yeah, I tried that a few years ago prior to some of my facial nerve surgeries. They actually put it on to test out the type of weight to put in rather. So I've tried that. I've had like the tear duct, the plastic thing that they put in the tear duct, but those fall out. And so many other procedures as well, but I haven't found anyone who does the weight on the outside. I haven't heard of that in a long time. I thought that was like something that they did a few years ago. So I'm curious to see if that helps.
Mhm. There's a product, is it Blink Ease that I'm thinking of? I don't know if any of you are familiar with that. I just
I'll have to
remember
look.
some kind of obscure product. I used to hear about it. I haven't talked to anybody about this in years really, but a long time ago, I used to talk to more people with like, I don't know, complications after blepharoplasty or other situations with non-closing lids. Sometimes if there were issues where they felt that they weren't a good candidate to get weights implanted, they would get these external stick-on ones. Seems like I had talked to someone where having an implanted weight, when they were sleeping, it would sometimes drag the lid back, and so it could be counterproductive in some ways. So just kind of looking at the breadth of medical treatments we've talked about. Of course, there's the classic dry eye things and the plugs and the medications and so forth, but you guys have covered a lot of ground with just lid surgeries of various sorts, the weights, and then there's like bandage contact lenses and amniotic membrane and things partly for protection. Are there other things in the purely medical side? I mean, then we'll get on to kind of the practical side of some of the day-to-day tools, but just wondering if there's any other medical treatments you wanted to get out on the table that you'd tried and had success with, or tried and they didn't help.
I mean, I've had a few different facial nerve surgeries, just like super quickly. My doctor here on the East Coast, we tried a bunch of different procedures, taking muscles from different parts of my body and putting it into my face and reconnecting it with the nerves. And the final procedure that we could possibly do to help to get some muscle movement on my right side, my doctor came to us and said that in the medical journal that he received, the plastic surgery medical journal, there was a doctor in LA who was doing this procedure completely differently than everyone else. And so he insisted that we get in touch with him, and he set up a meeting, and we got in touch with this doctor, and he does a lot of facial reanimation surgeries. There are a few, but this doctor in particular is kind of pioneering different techniques. And so many doctors will take your temporalis muscle and kind of flip it, and that helps to bring things up. And what he does is slice it and it slides it down. And I found that that definitely helped 2 years ago to give me movement again. And that helped to stop the sagging, because a lot of times when your eye can't fully close, you do develop a little bit of a sagging, which makes it even harder to close your eye. And so I know that there are a lot of other techniques and doctors doing this now. And this same surgeon, as I mentioned, is going to be doing a procedure on me again to help. And they do factor in like your age. Obviously, this is a lifelong thing that we're going to be living with. So certain things that some doctors may do to older patients, they're not going to do to a 20 or 30-year-old. So it's a very long trajectory, but it is nice to see, like, if you just Google around, and I'm happy to share doctor information with anyone, but it's nice to see that there are options coming our way, hopefully.
Absolutely. I mean, we live in all things considered, we live in a good time for this sort of stuff to be happening. There's just so much research and new techniques and new products and things being developed. Anybody want to add more on the medical side before we move on to the...
So I actually, based on what Alyssa was saying about the different surgeries and such, I actually had, what did they call it? A nerve
graft?
A nerve graft, yeah. So they took my, they took some nerve from the back of my ankle on my
Yeah,
left
me
leg.
too.
I put that up there, and then they gave it a year to make connections, and then they took some muscle from my right thigh and put it up there, and that was supposed to bring up my smile, actually. And that's actually why I have the sort of a lump on the side of my face, because there was like fatty tissue that they didn't think was gonna be there or didn't warn me about. And I was like a teenager at the time, so it was kind of upsetting. But yeah, I forgot what my point was with this. um yeah, so I've had various surgeries suggested to me, but ultimately, after I saw every single eye specialist that Kaiser had in the Southern California area, what the last one told me was your eyes, your corneas look actually pretty good for everything that you've been through, and we shouldn't, you don't need to consider any more surgeries for right now because you're young, and surgeries are always a risk and going to, might cause more damage and everything like that. So yeah, so that's what I was thinking about when she said, 20 to 30 years old and versus someone older, and the risk and everything involved in surgery. So that's what I've been told at this point, with like, there's no point in any more surgeries for a while until things get desperate, I guess.
Right. Circling back to you for a minute, Brittany, you had recurrent corneal erosions on top of the exposure thing. And that's a huge deal itself. And it sounds like you had quite a bit of trouble just getting that diagnosed. Did you go through any other procedures that they do for that sometimes, the debridement or stromal puncture or those sorts of things?
No. They wanted to try like kind of build up to that. That was gonna be one of the options if the gold weights didn't work. So that would have been like one of my next steps. Fortunately, since I had the gold weight surgery last year, of course, I had an erosion that night of the surgery. It took me a little bit to recover from that. And then I had the corneal abrasion. And then I had an erosion back in December. Knock on wood, that's been the only erosions I've had in the past year. Unfortunately, it's not if I'll have another erosion. I'm sure I will have another erosion. It's kind of like a win. And that's another thing. I have anxiety and falling asleep at night, and I'm afraid of when's it going to happen? Is it going to happen in the morning? And that's kind of an every night thing. I was going to mention one of the other treatments I did have was the blood serum drops, where they draw my blood and they spin it. And I think that was an important step for me. It's not something that I do now, but at that time, I believe it did help. I did see some improvement with the blood serum drops, but ultimately, there's just so many treatments I can do. But if there's just that exposure there, it's just like putting a Band-Aid over like a really large wound. It's just a small temporary fix, and it's just going to keep reopening. It's going to keep happening if we can't get to the root cause of it. And that's why I wanted to do the gold weights, is if I could, I felt like if I could get the eyes to close, then maybe my epithelial layer, like when it would reattach, because that's what the membrane was helping with, was the reattachment, and it was healing, the cornea was healing. And then all it would take is one night of a really bad exposure with my lids open, and that's all it would take. And then it's like I'm back to square one, and I have to go through the whole entire cycle again. And somebody mentioned taping. Yeah, I think it was Alyssa. Taping, very difficult to do. I feel like I had to get it just right to work, and it was like a 1 out of 10, that I would actually get it taped properly, and they would still somehow make their way open. And then that was actually even worse, because it's like the tape wouldn't even give it a chance to kind of even have a chance of closing. And I don't know, how do you guys feel about me showing you like some pictures from my gold weight surgery? Would that be okay, Rebecca?
Are they scary?
A little bit. So I guess if you don't want me to, that's fine. I just figured, like if anybody was thinking of the gold weight surgery, I'd kind of give them an idea of. But I had a really bad experience with it because my the cornea shield cut my right eye.
Right. I mean, it is important for people to know that going into some procedures are minimized in terms of the risks. You go in and you haven't been told that there's any significant risks, or the doctor's you might have to sign something that says there's risks, but they might get kind of minimized in the conversation. So I do think it is important for those experiences to get out there. I'm not quite sure what to say about pictures because I see gory-eyed pictures all the time, but I don't know if everyone else is. Does anybody?
I think it's fine with me.
Okay, it's just kind of like looking at the stitching and my eyes are swelled up. Okay, let's see if I can figure out how to share my screen here. Host disabled screen sharing. Let's see.
Ooh, I'm not sure if we can do it in the format.
Yeah.
You want to try again?
Try it again.
Yeah.
Yep, there it is. Let's see. So I guess it'd be here. Okay. Let's see. So it would be. Can you guys see my screen here?
Mm-hmm.
Yeah.
Yeah.
All right. So here's just a couple pictures. I look really crazy in this picture. But this is actually shortly, like about 2 hours after I left the hospital and I was still passed out. I had to take the shield off because it was filling up with tears. And that's where my right eye. So that's my right eye. That's where the shield had cut it. Didn't know it at that time, but I knew something was really wrong. I kind of knew.
That's what you were caught it. Yeah.
Yeah. And then that was the evening of, they finally got my eyes open. I couldn't open my eyes really for a couple days because they were swelled so bad. Then of course, let's see, this was about a week post-op. So I could open my eyes at this point. But vision-wise, I couldn't really see for about a month. About 2 weeks later, my left eye started coming back. My right eye took about a month. And then now I have double vision in my right eye from the cut. And also what's happening is the weights are putting pressure on my eyes. So every day I'm waking up and just my vision's different every day. I call my right eye my bad eye. I'll go ahead and take these pictures off if you guys are having trouble looking at that. But yeah, my right eye is my bad eye because where it was cut, the weights are pressing down, constantly reshaping my cornea. But fortunately, they said it's not very deep. So my next step is scleral lenses. And the idea is to kind of provide a vault to keep the weights from pressing down on my eyes so my vision will stop changing every day.
Yeah, I'm one of the people that has vision that fluctuates a lot, and scleral lenses help to keep that more stable to a large extent. Wow, thanks for sharing that. Yeah, you had such a complicated situation because you really, as I understand it, you had this intersection of two problems, right? The exposure thing and the recurrent erosions. And those are both problems that to a large extent can fly under the radar, both medically and in terms of life impact. And getting both at the same time, geez, it's a really big deal. I remember, it kind of took me back to when I first started the dry eye zone. This is like 16 years ago, and I was in Florida, and I had been spending a lot of time just digging into the medical literature and trying to understand stuff about dry eye, also about recurrent erosions and things better. And I went to some presentations at a conference at one of the universities down there, and there was this one that I will never forget. I mean, it was just kind of early research on something, but so they were researching corneal erosions. And one of the ways that they were doing it, this was animal research, right? Sorry if that is bothersome to people to hear. I don't, but it was on mice, and the way that they were inducing recurrent erosions was doing PRK on the mice.
Oh, okay.
I
Yeah.
remember at the time thinking, okay, what does this mean? PRK is also an elective surgery we do to correct vision, but they're doing it and it's causing recurrent erosions. That's when it clicked with me. All the people that I knew that had recurrent erosions after PRK, I wondered what that link was and why. But yeah, and you had the exposure to exacerbate it all too.
Yeah, and I see after my PRK, I saw the follow-up doctor for almost a year, and my last year checkup was with the doctor who performed the surgery. He actually told me at that year follow-up that he doesn't believe I have recurrent corneal erosion. He said I was making it up. It was all in my head. So that really sent me, like, because, you know, I thought I was really starting to understand what was wrong with me. And it kind of really just sent me down a deep, dark path, because I started to feel like I was crazy a little bit, you know, waking up and in extreme pain, feeling like somebody was stabbing me in the eyes. And then this doctor who did my surgery, PRK, told me that it's all in my head. You know, of course, I've seen multiple doctors after that who have confirmed, but that was really, that was difficult. But it was definitely PRK that caused it, the erosions.
Yeah, wow. Okay, gonna shift gears a little bit, just more into from the medical to just the purely practical. What's the stuff that helps any of you get through the day, the practical things? I don't know, humidifiers, goggles, what sorts of things other
Can I
than,
go?
sorry?
Can I talk about that?
Yes, please.
Oh, cool. Okay. I use an alarm on my phone. It reminds me every 30 minutes to evaluate, do I need the Celluvisc, which I find is my most effective when I am awake gel drop formula. I keep it in the refrigerator. I keep the vials in the refrigerator. The chill gel is more soothing for me. It's also, I use this 30-minute reminder to tightly squeeze my right eyelids together. I also roll my eyeball around inside, you know, change directions. And that helps distribute the Celluvisc and provide that windshield wiper effect that all of us struggle with. And then just before bedtime, I use an ointment, either the Bausch& Lomb Soothe or OcuSoft Retain PM. I have tranquilized goggles, and I kind of struggle with these, but they do help keep my eyelid closed during sleep. What else? My practical suggestions: be proactive about keeping your eyes irrigated. As soon as you discover that you have a problem, whether your medical professionals concur, work on your irrigation. Don't wait until you reach a discomfort or pain level, because it takes a while then to moderate that. And sometimes I can push my insertion to 40 minutes. Um, Please try to stay away from preservatives and products if you experience any sensitivity. Some of the chemicals, like the BAK, in my opinion, they're very nasty. Don't use any products labeled "get the red out." That just exacerbates your dry eye. For me, large wraparound sunglasses are hugely important. I am more light sensitive than ever, especially since the facial nerve damage. The wraparounds also minimize the breeze so that my eye does not dry out as quickly. I'm very careful about where fans blow, both interior and in my car. I am fortunate to live in a climate here in San Diego where residential heat is rarely needed. AC is becoming ubiquitous as our climate changes and things get warmer. I always have vials of Celluvisc in my purse and in all my pockets. Um, I'd like to try utilizing the moisture chamber glasses. I've learned so much about those from the dry eye happy hour. And right now, I'm not financially able, and I am appealing to my insurance provider for an accommodation.
Ooh, I love that you're doing that. Moisture chamber glasses are such an important tool for a lot of us, and they need to be more recognized for what they do and be able to get coverage, through insurance, through employers. I remember being really excited the first time I heard from someone whose employer paid for their moisture chamber glasses as, a reasonable accommodation. I mean, we're all in different circumstances and different needs and things, but I like seeing them be seen as a little bit more of a medical device that helps us get through our days. Thanks for sharing all these different practical things. That's really great. Light sensitivity. Yeah, that was kind of bringing me back to our topic. I never actually asked the question, how has this impacted you, practically in life? Because I think everyone has shared about that. But any of the rest of you struggle with light sensitivity issues? You do, Brittany? It sounds like I definitely do.
Yeah. Which I've always had a little bit of light sensitivity issues, and I have really light colored eyes, so I think that makes it worse. And then, of course, after the surgery, it everything became worse. So
right. When did the tables turn on the surgery where you were like, this is my thing, this has helped me?
Really recently. So the gold weight surgery, I'm probably really in the last month or two, I've started to kind of get better, but up until that time, I was still really struggling. I also am worse during the winter time, so that might have something to do with it as well. Summer is a lot better for me. So I don't know if I'll go back to where I was when wintertime comes, but for the last 5 years, when wintertime comes around, I do get worse. But I'm hoping that maybe this weight exposure and my corneas had a little bit more time to kind of heal back up, and my epithelial layers being able to reattach. So, we'll see, but it's still a work in progress. I still have to do all of my drops and my ointments, and I sleep in the tranquilized goggles. I use the Miro 128 ointment, fresh coat drops, sustain. So I'm still doing that every single day, and I still definitely think that it's necessary.
Mm-hmm. Tranquilize is one of those things that it's like there's always a little question mark for, and depending on the specifics of it, right? I mean, I know a lot of people with exposure issues where they use Tranquilize specifically to hold the lids down, and others that can't just because of the way the positioning is, where they've got risk of the pad coming in contact with the cornea, right? Mm-hmm. And any others of you used Tranquilize? Alyssa, are you familiar with that?
No, I haven't heard of it. So what does it do exactly?
I might actually have one here. Just one sec.
I was recommended those the first time I met with my oculoplastic surgeon. They gave me the link to the Tranquilize site and recommended those. But I struggle, Rebecca, with what you said. Sometimes I'll wake up and my cornea, my eye will just feel horrible, and I will take off the goggles and discover that my eyes are wide open, that the pads inside either shifted or I shifted, because right. It seems like I'm a side sleeper by preference, and wearing the goggles is problematic.
Yeah.
To be a side sleeper. And I find that the goggles are most effective if I sleep on my back, which is like not comfortable for me, reminds me too much of all the surgeries, especially the brain surgery. Um, so it's, you know, sometimes helpful, sometimes not.
So Alyssa, the thing we're talking about, I have like one pad in and one not. It's this goggle. They're not all pink. They come in different colors.
Yeah.
This thing you put on. So it's got these deep cushions around the outside. It's like a memory foam.
Right.
And then these pads that you can get wet and put in. And you can kind of customize the depth of the foam. So like somebody with deeper set eyes can put extra foam in there so that it will press down more on the lid. Or you can, I know some people who will like take them and slice that foam in half to make it thinner and push it to the back. So it's holding moisture there, but it's way high over the eye so that you don't have anything touching.
Okay.
And the same company that makes these, I put a link in the chat.
Yes,
They have like some other types of vaulting shields where you're just trapping the moisture and keeping out moving air, but not touching the eyes. Tranquil is like a really well-loved product and it works really great for a lot of people. More than 10 years ago, I came across somebody who had Graves' disease, so their eye was bulging and the pad abraded their cornea really badly one day. And ever after that, I'm like, okay, just be careful.
Yeah, of course.
So the
I was actually, I was going to mention that I take the pads out because like you said, I can't have the pressure because if it pushes anything, pushes down on my eyes, it'll rub the layer off and it'll cause an erosion. So, I just have that vaulting to try to keep air from drying my eyes out from that exposure.
That's so interesting because I recently saw my eye doctor and she was telling me to get, I think it's called the Meebo, the one that it actually would be the opposite. It's a hot compress that goes on your eyes. And she said, she's like, regardless of what I've been through, everyone should be doing this outside of work. Like you're on the computer all day, it's straining your eyes. And so I have to go on and order it because I've now noticed I'm actually like paying closer attention now that she's said this, that I do need to give my eyes a break. And I think during the day, I also sometimes wear the blue light glasses, and I don't know if it's psychologically I feel better using them on the laptop or not, but I do find that when I use the blue light glasses, I don't have to use the eye drops as much. So that's good at least. But Brittany, what you were saying in the winter, it's hard. I struggle with that all the time. I find that like during the change of seasons, my eye also has to get accustomed to it. And I have to get like acclimated almost. And so I noticed that the winter and the wind, Phyllis, you were talking about the wind is like awful for me more than the light. The light, I was trying to think as you guys were talking about it, I don't know that light really affects me as much, but the wind is like my worst enemy. I hands down will avoid a windy day. I'll wear sunglasses, even if it's nighttime and I'm walking, home from work or something, I'll put my sunglasses on or glasses that don't have a prescription just to block the wind.
Oh yeah, I'm famous for wearing sunglasses at night, but that's been a kind of a lifelong thing. And Rachel, when you mentioned the Santa Ana winds being bane of your existence, boy, I can so identify with that. I literally don't want to go outside because there's no humidity and we have these hot, dry winds. Just, there's not enough drops in the world.
Yeah. I tried I actually have them. Oh, I can't do it because of my background, but I have, I'm trying out the other eye eco stuff, the quartz and the eye seals 4.0 right now. And I'm probably going to send one back because my budget is just like that right now. But I think I like the eye seals better, even though I was worried about like thinking that like, oh, I read on the website that quartz was better for ladies with tiny faces and eye seals might, not be, but I actually like the way that they fit on me a little bit better. I've been using a humidifier, and I started using distilled water instead of tap water. And trying to do everything right, because I figured I was doing some things wrong. I sometimes use this tape, the blue silicone tape, to just tape my eye down at night. It doesn't work as well if I put some kind of ointment in it first, but putting in the ointment, like the Refresh PM, before I put like the goggles on, can really help like a lot with, I wake up and the glasses are just, you can tell how much moisture was up in there, and it's really nice. I also have the Target things. They're just more like a spa day kind of thing, and I use that in the freezer, and it's just really nice just to lay down and for 20 minutes or whatever, and kind of refresh your eyes. I also have one that goes in the microwave. It's a little bit different and has cloth on the outside, so that one's okay, but not as nice. And I was thinking about, I'm not sure what they're called. They are available on your website. I actually got a small one on your website after a doctor had randomly given me the samples that were in their office, which were large. It's just like a single eye patch sort of thing. It was like clear with like foam around the edges.
Is it the Solo Shield? Like a clear plastic shield with a little white foam around it?
Yeah.
Yep. Mm-hmm.
Yeah. And I noticed that, the large ones did nothing for me because it would just not fit my face right. But the small one actually did make quite a difference. But it was just, it's weird because I feel like I can't like clean it properly, and it's not supposed to last that long. So I don't know if you have any ideas for that.
Talking about like the Pro Optics patches. Is that what those are, where it's like a clear is it flexible or hard plastic?
Mm-hmm. I really, really wish there was something like the eye seals, but for one eye.
Yes. Yeah, yeah.
I second that, because having to only deal with one side, some of the things are just more than if I could find some like a tranquil eye thing that only fit on one eye, then I could sleep on my other side, and have the best of both worlds. Also, one thing I meant to mention, now that we're all using technology 24/7 and our screen time is off the top end of the scale, Rebecca, you turned me on to a site called iBlink Matters or blinkingmatters.com.
Mm-hmm.
Boy, is that literally an eye opener. I have it on my laptop, and now it's reminding me even more than my every 30 minutes to blink, because the more screen time we do, the less we blink, which is very detrimental to all of us with any kind of ocular surface disease.
I'm so glad you brought that one up. I mean, just the idea, just the blink reminders in some fashion. I love the Blinking Matters one because I don't know if the rest of you are familiar with that at all, but if you're willing to let it use your camera on your computer, it will track your blink rate and give you feedback about how frequently or infrequently you're blinking too. And so.
Right, and unfortunately, the more screen time we have, the lower our blink rate gets. And that just leads to more tired eye, more inflammation.
I'm pondering some of the product suggestions you guys have made, because these are the sorts of things I like to get out there with manufacturers and say, hey, we need one of these. Our community needs one of these. The folks with Bell's palsy need one of these. We need to get that story in front of them, that here's what we could do with. I mean, honestly, all of the iEco products I would like to have a one eye version of. I actually tried to make my own with the quartz at one point to get just a one eye thing there. Any other ideas, anything you want to share here, or shoot me an email or something afterwards? What would you like? What would make life better as a practical tool?
Wow, to have some of our practitioners, Brittany, I feel so bad for you that your PRK surgeon just completely disrespected you. And, to be told that it's all in your head. I mean, we all have so much anxiety from all the stuff that we deal with, that to then be told, oh, you're making this up, it's all in your head,
Mhm.
that to me is just unconscionable.
Yeah, it really, I mean, I did not feel validated at all, and like I said, I went down a very deep, dark path after that. I felt like I was crazy. I felt like all the research I'd done was kind of just obsolete. And it made me just realize that there are doctors out there who aren't really there for your best interest. I think that he was more worried about the fact that he might have a lawsuit or something on his hands. So he was just kind of, he was right there at that 1 year mark. And in Kentucky, the statute of limitations is 1 year. So he knew he was getting close to that. And so that's why he just kind of was trying to steer me away from believing that there was actually something wrong with me, that I was really pretty kind of crazy, and but I'm glad that I found other optometrists and other ophthalmologists that definitely confirmed it over and over again. That's what really helped too,
And
I was gonna mention something too about the I think it was Rachel talking about the eye seals. See, personally for me, the eye seals were not good. It's like it provided too much of a bad moisture for me. I think that because I read that a little bit of oxygen is actually good for your eyes at nighttime and aids in recovering a little bit. But it's like whenever I wore those eye seals, like I could see the moisture in there, and you'd think that would have been great for me, but that was a very bad time for me personally. And I think that's why it's so important for people to know, if one thing doesn't work for you, it doesn't mean it's the end of the road. What works for me might not work for someone else, and vice versa. And I think that's just important for people to know, that just keep trying, go through all of it. And that's the great thing about the iEco website. You can order 3 pair of goggles, different kinds, and try them, and what doesn't work for you can send back. And that's what I've done in the past, and that's how I kind of found the tranquilizer, and that's what worked for me, and I stuck with it.
They have a really good return policy that it's support. They clearly understand well that we have to be able to experiment with stuff, and that's super important. I think I would just add to what you're saying about, one thing working for you, one thing not working for you, different things working for different people. I would also add that different things work at different times. I mean, I have all the goggles they've ever made in my drawer, right? But there are some times when one just, I can relate to what you're saying about putting something on and almost feeling like it's worse. There are times I'll put a goggle on and next morning I'm like, I almost feel drier than I did before. I don't know why. I can't explain it. There's a lot of inexplicables about our ups and downs with this stuff sometimes. But I'll get into the winter and one of them will just work better for me. Get into the summer and I won't want to have anything on my face. Other times have some kind of a spike and I want to max it out, and whichever thing is looking like it's giving the most moisture will work well. And other times I just go back to tape. Tape is simple and kind of barbaric, but boy does it, if you can get the lid taped down, and I do understand we can't all, but that can be really good protection too. All right. How about best advice that you would give to your younger self? If you could reach back and give some advice when you were going through, say, one of the worst times with this, what do you wish you had known? What would you want someone else going through this to know?
I can start.
Sure.
I'd say that you're not alone. And I think that, again, it all comes back to, and Brittany kind of touched on this, like what doesn't work for you may work for someone else and vice versa. And I think that now with social media and different platforms, like we are, again, just so fortunate. When I think back to when I had my brain surgery, that wasn't a thing. Like I would never take a photo of myself going through surgery. But now everyone's doing it because it's helping other people. And there's just so many different networks out there. And it's just nice to see that there is a community and you don't have to go very far to find it. And so definitely I tell myself, you're not alone. It'll all work out in the end. It's going to be a lot of trial and error, but it's going to work out.
I love that. That's great.
I want to say, carry your eye drops all the time and use them all the time. Because that was definitely one of the things that like my mom was always bugging me about when I was a kid. It was like, have you used your eye drops recently? And your eyes are starting to look a little red. Things like that. But also to echo what Alyssa said, I mean, it's great that things, like the internet exists and that communities we never thought were, were around. They're around now and accessible anywhere. So do the research, because for quite a few years, I think I saw Dry Eye Zone or something on the corner of little pamphlets and things that doctors would give me, but nobody ever like really emphasized it. And finally, they were emphasizing the Boston site stuff and everything like that. And I actually looked at the stuff because this whole scleral lens thing was new to me. And I looked at the stuff and I did the research. I looked at Dry Eye Zone and Dry Eye Happy Hour and all that stuff. And I started and I found this community. So just, you're not alone. Do your internet research and you will find the people you need to talk to eventually.
Awesome. Love that. Phyllis, I think you were talking earlier, am I remembering right, just about, how we could just get information about the foundation out there through more.
Oh, yeah. I think that would be so wonderful because especially like when I go to the ophthalmology people or the oculoplastics, they have just tons of little brochures. A lot of them are from the product manufacturers. And unfortunately, I don't even remember how I found your foundation, but it has been one of the deepest sources of practical, useful information for me. And I always try to share with my practitioners, hey, this is a resource you should be promoting to other people, and we all need to, as much as we rely on our medical professionals because they've got so much education, all of us who live with this, we have our own level of education. And sometimes I feel like it's almost more education and knowledge than some of my medical practitioners. And I really learned to trust my intuition more. Sometimes products will be recommended and my gut feeling is no, not for me. Or sometimes I'll say, hey, I was doing some internet research and I found this. And sometimes I get that woo woo look. from some of my medical practitioners. And also try to find specialists as early. I wish I had known this much earlier in my journey. Try to find the specialists as early as you can. Don't be relegated by your insurance to conventional practitioners who don't have the specialized knowledge that can help improve your life. And one of the biggest things, look for those resources. And dry eye, to me, is such a misnomer. Rebecca says it best. We have ocular surface diseases, which has a whole lot more impact and weight, in my opinion, than, oh, I have dry eye.
It's just not possible to take those words seriously, is it? Dry eye.
No, it's just, it's just shooting yourself in the foot. Because I know when I mentioned to people early in my journey, oh yeah, I have dry eye, and people would just sort of look at me, well, use some Visine. And I'd go, no, that's not helpful. But now if I say, oh, I have ocular surface disease, I get a lot more respect.
And part of what I'm taking away from what you shared, but just more broadly with the advice, was about the living with the disease. I mean, we've got medical experts. It takes time and effort to get to the right ones, of course, but we got the medical experts to manage the medical side of this for us. But living with the disease, we are the experts. And that's why everything all of you are saying about social media communities coming together is so important, because we get to pool that information and all benefit from it. Brittany, last words of advice, wisdom from your journey from birth, really.
Yep. So my best advice to a new patient, I took some notes here, so I'm looking at my notes. I keep accidentally hitting that. Don't give up if something doesn't work. It's not always the end. And I know through my journey a lot, I have felt like it was the end. I felt like I had done everything I could do, and the doctors had done everything they could do. And, I think that I'm not alone when I say that because of this, there have been like suicidal thoughts. And especially in the first year when I was really having the toughest time, and I felt really alone because no one around me had even went through anything remotely like what I was going through. And I tried to explain to people, and eventually I kind of went into myself, and I almost felt like a burden. When I would try to tell my story, and like Phyllis made the point of, if you say you have dry eye, people are, just use some eye drops. It doesn't sound that bad, but they don't realize that everything, the way I have lived my entire life has changed. My advice would be, don't believe that you're alone, because, we have so much information now that we didn't have even 10, 20 years ago. And to, not give up. We have this dry eye group. And for me, it's been pretty well, a lifesaver, because I felt so alone, and I reach out. And don't be afraid, especially when it's people who know what you're going through, to, ask any question. There's not a stupid question that doesn't exist. And really kind of sink yourself into other people, because in the end, really, that's kind of what we got. And, adding to that, we are kind of the medical experts, and the doctors aren't always going to know. No one knows your body like you do. If you think that there's something going on, but the doctor's not seeing it, usually your gut instinct's going to be right. So I think you need to stick with that. And, if one doctor doesn't work and you don't feel comfortable with them, or if they're just not telling you what you want to hear, go to another and another and another. Do not give up, because there's just so many doctors in the world that, you can keep on trying. And I'd like my younger self to know, don't have laser eye surgery. Yeah, don't do it. Just I should have just worn my glasses. I was in the military, and I didn't want to have to wear glasses when I was at training. It would just been a lot simpler for me. And then, of course, laser eye surgery really made it more difficult. I thought it was difficult, but here I am, 9 years almost in the military, and it for about a year I had to get out. It almost ruined my military career. Luckily, I'm in a medical unit now they're very understanding. They're part of the medical community. They take me serious. I'll be going to school this year in Texas to be an optometry technician. Hopefully begin my journey, and one day, if I can get enough money or get loans or get help, I'd like to be an ophthalmologist. I think that this happened to me for a reason, and I think that reason could be to help other people and bring awareness, because people just don't understand the seriousness of what we have to go through. And I think it's important, when you say you have cancer, people automatically go, oh no, and they feel for you. But when we tell what we have, it's not like that. They don't understand that. So I think that it's, important to get that information out. And I think that that's going to be kind of my life goal now, because I'm going to deal with this forever. And I want to help people. I want to be that ophthalmologist that people come to and say, this is the one that helped me or saved my life. Like, just that those 2 or 3 have done for me.
That's awesome.
It's just really wonderful and inspiring. I think you're going to make the most.
Wow, Brittany, that's fabulous. And
Thanks, guys.
good luck on your journey.
Thank you.
Keep us posted.
Absolutely.
How that goes. That's just really exciting. This is what we need in the medical fields that are helping us. We need people who have gone through these things and get it, who can wrestle with the things that really matter to us. Wow, it's almost 4:30 already, so I'm going to go ahead and start wrapping up. And I'm sorry if we didn't all get a chance to say everything that we wanted to, but this has just been a really packed session. I just appreciate you all so much. Thank you for just taking the time and effort and being willing to talk about your stories and the things that are helping, and just the wisdom that you've gathered along the way to get through this all. It's really tremendous. I'm just so proud of our community and what everyone brings to the table. Dry eye or ocular surface disease, as always prefer to say, although we're kind of stuck with dry eye to a certain extent, it's an isolating disease, and our best weapon is to get together on it and keep the conversations flowing and keep moving forward. So again, thank you very much. We've got, Aiden, what's coming up? We've got one more in June, right?
One more Friday. Yeah, next week at the same time.
Okay, so that's our usual 3:00 support group session. After that, it's Dry Eye Awareness Month, and we've got some plans coming up that we'll be talking about later on in the month, and we still have to figure out where we're going with Dry Eye Happy Hour from here, but we'll be doing something in July for that. So looking forward to it. All right, everybody, thank you a million, and hope you all have a great weekend.
Thank you.
Thank you.
Bye.